In today's HealthCast, a puzzling condition that doctors say often goes undiagnosed, leaving patients feeling miserable and unable to work. And it all begins with narcotics, prescribed to treat pain. But as our health specialist Christy Kruger shows us, those drugs can sometimes surprisingly have the opposite effect.
Many of us have the occasional backache or stiff neck, but 53-year-old Patrick Mercadante lived with that pain 24 hours a day. The married father of 3 has degenerative disc disease, and for years the pain was managed by heavy narcotics like morphine. When the pills seemed to stop working, Patrick's doctor suspected the problem was something called opiate-induced hyperalgesia.
We're not really sure. The narcotics can actually start to stimulate pain. And you can start having escalating dosages of pain, not because the condition is getting worse, but that narcotics themselves are causing pain.
The idea that his painkillers were causing the pain was something that Patrick found shocking.
I was still intent on the belief that if I didn't take the pain medication, my pain would be worse. I've already gone through 2 surgeries. What next? So I continued to use the narcotics, even though the dosages were just through the roof.
Finally, in pain and unhappy with his growing dependency on painkillers, Patrick was willing to try something new. He and his doctor turned to Suboxone therapy.
When you stop the medication for 24 hours, you're going to go through withdrawals. You're going to have nausea and vomiting, shakes, tremor, irritability, total body ache. You start the Suboxone, it immediately stops the side effects of the withdrawal.
Suboxone works by relieving some pain while blocking the opiates from having any effect. It's a therapy used in the treatment of addictions with good results. To date, Patrick is treated with anti-inflammatories and muscle relaxers, as well as the occasional steroid injection. And now his quality of life has improved dramatically.
I feel physically good, mentally clear, without a doubt. I feel like I can pursue things that I couldn't, and I'm enjoying life much more than I was before.
And that's a good thing. Another note here, the FDA does require the doctors get very special training to administer Suboxone. Patrick, by the way, has been narcotics-free for several years. Good for him. Janine?